Hello, my name is Susana Hernandez. I'll be your nurse practitioner for today. I'm going to be performing an HEENT exam, which is an exam that consists of your head, neck, skin, and facial features, okay? Do you give me consent to continue?
Yes.
Okay. I am washing my hands. Can I get your full name and date of birth?
Yes. Marcos Eugenio Velasco, February 26, 1995.
Great. A couple more questions for you. Where are we located today?
At the hospital.
And what year are we in?
2026.
And who is the President of the United States?
Donald Trump.
Okay. Patient is alert and oriented times 4. Are you having any pain today?
No.
Okay. I am now going to move on to my assessment. I'm going to start with your skin. Patient's skin color is consistent with ethnicity, with no obvious lesions or deformities at this time. I'm now going to palpate your skin, okay? Okay. Patient's skin is warm, dry, intact, and smooth with no mass, lesions, or deformities noticed. Skin turgor is normal. I'm going to be assessing your nails now. Patient's nails are pink, no cubbing, ridging, or deformities noted. Nails are firm and smooth. Please flip over your hand. Capillary refill is less than 2. Thank you. I am now going to move on to your head. I'm going to inspect and palpate your head, okay? Patient's head is normal cephalic and atraumatic. Patient's skull and scalp is symmetrical with no obvious lesions, deformity, masses upon palpation. Patient's hair distribution is even. Hair color and texture is normal as well. I am now going to assess patient's facial features. Facial features are symmetrical with no abnormalities and no involuntary muscle movements noted. I am now going to move on to your sinuses, okay? I'm going to be palpating your frontal sinuses, which are located above your eyebrows, your maxillary sinuses, which are located under your cheekbones, and in your mastoid process. Please let me know if you have any pain when I do this. Did you have any pain?
No.
No tenderness to palpation to either frontal sinuses, maxillary sinuses, or mastoid process, and all of them are patent. I am now going to move on to your neck, okay? Patient's neck is symmetrical upon inspection. Can you please look up, look down, look to the left, and look to your right? Patient's neck endorses full range of motion. I am now going to palpate your neck, okay? Patient's neck is symmetrical and at midline. Trachea is at midline with no masses or fullness upon palpation. Trachea has no deviation noted. I am now going to inspect your carotid arteries. Carotid arteries do not show any pulsation or distension upon inspection. I am now going to also take your carotid arteries for Bruit on both sides. No Bruit noted upon auscultation of bilateral carotid arteries. I am now going to move on to your nose. Patient's nose is symmetrical and at midline. Nose color, shape, and size is normal. I am now going to assess the patency of the patient's nares. If you can please put your finger over your nose, please. One nair, and breathe in through your nose. Great, and do the same thing on the other side. Okay, bilateral nair patency intact. I am now going to palpate your nose, okay? Did you feel any pain when I did that?
No.
Okay, no obvious mass, lesion, or cartilage deformity noted upon palpation of nose. I am now going to inspect your nose, okay? Please look up. Okay. No nasal mucosa is pink, moist, and intact with no lesions, drainage, swelling, or deformities noted. Septum is midline and symmetrical with no perforation or deviation. And patient's turbinates are normal. I am now going to move on to the patient's lips. Patient's lips are symmetrical, pink, and moist with no obvious lesions or cracking. If you could please open up and say "ah" while protruding your tongue out.
Ah.
Okay, great. And then just stick out your tongue for me. Okay, great. Patient's cranial nerve number 12 is intact with tongue pink, moist, and no lesions, symmetrical, protruding at midline. Patient's uvula rises with phonetics, and patient's uvula does not endorse any swelling, and it is no lesions, no masses, pink and moist and intact. Can you look up? I'm going to assess the rest of your mouth. Open wide. Okay, patient's soft and hard palate is pink and moist and intact with no masses or lesions. Patient's gingiva is pink with no bleeding and no swelling. Patient's buccal mucosa is also pink and moist with no obvious lesions or masses noted or deformities. And patient's teeth is intact with no missing teeth present, no tooth discoloration, and no caries noted. I am now going to elicit your gag reflex, okay? Okay, gag reflex is intact. Patient's tonsil grading +1 with no swelling, no deformities, pink and moist and intact. That concludes the end of my assessments. Do you have any questions?